22 days. Some feel, well, in the history of agitations, it's nothing. But when you look at it, that they are the backbone of the rural healthcare system, they are the frontline warriors. These were the women who were handling, all the needs during the pandemic. This seems grossly unjust, J. Devika.
Yes, it is a gross injustice. It is. You know that Kerala is a highly densely populated state. So, natural disasters like the 2018 flood or the pandemic could have had impacts that are terrifying to even think, because these diseases can spread rapidly through the population, a very densely populated region. Now, if Kerala was spared the horrors of many deaths, uh, the horrors of spreading epidemics post flood, and the horrors of COVID spreading rapidly through the population, the credit for that goes also to this large workforce of health workers, women health workers, who risked their lives. And remember, they were not even given safety equipment,
Right.
PPEs. They went from house to house. They answered, picked up calls in places where volunteers could not reach, or volunteers would be too late. I personally know ASHA workers who have gone to houses
Also, I'm
and
sorry to interject,
have,
Devika, but now it's become a political hot potato with LDF and UDF, really trying to put their thoughts. But, I'm not. All I'm saying is, do you agree with what Veena George has said, that Kerala pays the highest honorarium? Would you like to comment on that?
not anymore.
Right.
She may have been right some months back or a year back perhaps, but Kerala definitely is not the state that pays highest
Tell
anymore.
me something. Kerala has very good healthcare records. I mean, if you go through, it's one of the best. I mean, it makes it to global research papers, and how during pandemic we set an example to the world. Then why is it? Then why is it that the Pinarayi Vijayan government, whether it was I'm not cherry picking on Pinarayi, I'm not going to cherry pick on other, but I'm saying, why is the government not blinking at all? It is not a huge sum of money. Also, imagine, you are not even called workers, you are volunteers. You don't have any fixed, imagine to work for 12 to 15 hours without payment. I mean, I think this is under the dispensation of Pinarayi, the kind of government that Kerala runs. What is this chaos which has unfolded on the streets of Thiruvananthapuram?
Yeah, you're right, Sudha. There's no need to cherry pick Pinarayi, because this is one of the foundation stones of Kerala's public health. Remember that the entire history of public health in Kerala has been built on the backs of low paid workers.